Systematic desensitization. So basically in this slides we are going to see what is systematic desensitization, and if you are a psychologist or a therapist it will be easy for you to understand the basic concept of this, and just simple slides with a definition and how you are going to use it in a therapeutic setup. So basically systematic desensitization, it is graduated from exposure therapy, right? So basically in these therapies will be used in setups where you have to expose the client to any fear, phobias which is associated with it, right? So it is basically a type of behavior therapy, behavior modification, and it is a form of counter conditioning. So basically conditioning, the term is familiar with most of the psychology students, right? So classical conditioning, so basically Skinner, and also there are so many people have done so many research on this. You all know also Ivan Pavlov, where there is a dog and bell, how they are pairing that and how they are creating a conditioning in a human. So basically it is a form of counter conditioning, and what is the difference means, it is a psychological technique again that replaces an undesirable response, right? So to a stimulus with a more desirable, often opposite basically one, by creating a new association. Okay, for example, here also we are going to see about the spider experiment where we all very familiar with. So if a person is so afraid of spiders, can be gradually exposed to them while simultaneously learning a calming relaxation technique. So if the person is seeing a spider, automatically we are connecting that with a stimulus or a calming response, right? Feeling so happy or not no happy, or basically feeling of calmness, right? A positive association instead of fear, worries, or any kind of negative pattern of thinking. This is used in therapies like sensitizing, and also for phobias, and also aversion therapy, right? It is also used for that. And most importantly, nowadays people are using also for the bad habits, which is very common, people usually have. For everyone in our daily life, you'll tend to have one pick a bad habit to associate with our life, or basically our what is that mechanism, dynamic mechanism. So it is created or developed by Joseph Hull during 90s 50s. So we can see here itself in an image, it is started with anticipations and frenzy, as well as fatigue, and finally I did it. This is a kind of feeling usually people go through while doing or exposed to this therapy. Next, it is an evidence-based therapy approach. Okay, so basically it is an evidence-based, and pairing again I have said positive response with a negative response. Progressive relaxation technique with gradual exposure to help slowly overcome phobias and anxiety over time. So basically how it works. So for initially we have to find a goal, which is very important. Okay, what is your goal? To change a reaction of a negative thing into a positive, for example, that is a goal. Then the process. So negative or feared stimulus, which is pairing with the new or positive stimulus. Okay, so how we are pairing that, and the final is result. So over time, how we are going to recover from that, the original negative response, how it is that replacing into a positive response, or basically a calming response to a particular stimulus. So that is how the brain can be associated with the stimulus and the new experiences. Okay, so basically the examples here are some overcoming fear, for example public speaking fear, or fear of having uncertainty, or breaking bad habits like smoking, or unpleasant experiences. It's like that. So also training animals. So in classical conditioning is a again the classic of training animals, like how it's like pairing with them, even if the person is so afraid of dogs, or if you want to have pairing with your anything else. So it is an easy form where we can able to associate that and to bring that into a positive as well as a new experience for the people. The prototype of this is a classical experiment of Mary Cover Jones. So this is one of the example. Basically for classical conditioning we have used this. So here they have given on rabbit. Obviously the people who is not exposed to rabbit or just in stimulus for them, they will going to react in certain way, right? So if you are going to give them a biscuit or anything cookies or chocolate, if you are going to give the student or any people, then automatically there is going to be some response which they are liking that, right? Is a positive stimulus. So again, if we are pairing the positive stimulus with an initial stimulus, which is conditioning stimulus, then automatically it is going to be a conditioned response to that, right? So again, after sometimes you keep on repeating the same connections with the person. If you just showing the conditioned stimulus, automatically you're going to receive a conditioned response, right? So this is a classical example. Just wanted to know you about what is this overview. Next, general procedures and variants. So systematic desensitization or is systematic procedures we can want to see a hierarchy of fearful situation which is created. Each test is being more fear provoking than the last. Obviously, there is going to be a few steps where the client is going to expose to that, and for each step, it is depend upon the individual. It is very very important. Depends upon the individual is going to change obviously because each and every individual is different on their own. So based on that, it is going to be changing. So the based on that also the fearful situation either created or provoking to the situations more or either less. Okay. Next, the client is taught deep relaxation technique is very 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 important in this therapy where you are going to teach the client about the relaxation technique and how to use them, especially whenever they are having a fearful situation or any kind of stimulus they are exposed to. Next one is the client learns to associate the relaxation with the least fearful scenarios, right? So the client started to associate. For example, here we have seen the positive versus the negative association, right? So positive association with it, which is a person may feel calm with a toy or a teddy bear. So how we are going to associate with that, right? So that is the one thing going to create a relaxation to the client. Next one is once that is achieved, the client is encouraged to systematically make step-by-step process through the hierarchy. Right? So in that hierarchy, we are going to help the client to achieve each and every goal, and the process we are going to stay with the client and help them to create relaxation to them and to attain the result. Right? Next is exposure and response prevention. So what are the exposures? Basically, these are the very basic techniques that in systematic desensitization people use. First one is flooding. Flooding is nothing but a full exposure to the at full length or exposure to the full length we can say. For example, if I am afraid of bugs, if I am afraid of just example of thought of having about the future. So basically, we can do the person with flooding. Like for example, we can say about the uncertainty of the things that was going to happen at the stretch. Okay, without any break, without any process, we can just flood them. If the person is fear of height, obviously we can ask the person to just face about the height. Just ask them to go and stand in the most. If the person is fear of having a height, they can go ask them to go in the ladder and just stand there. Ask them to see the view. So this is flooding. Okay, but it's not going to work for everybody. Obviously, it depends on the individual. We are going to change the exposure and also how the response is going to be prevented. Next one is imaginary exposure. In this, basically, we are going to use certain techniques like ask them to close their eyes and ask them to imagine of certain things that they are afraid of. And previously, I said about the uncertainty, right? That about the future, what is going to happen. So it is the biggest thing where people usually think a lot. So if we started to have overthinking about the future, so automatically ask them to imagine about the future that they want to have, or in a very mild way, or the scenarios that therapist can create and ask them to view about it, or else you can ask them to freely think about the things that they wanted to explore and imagine. Okay, next one is Vivo exposure, where we can show about the videos, bug video, or the if a person is afraid of dogs. So we can initially show the video of dog. People were friendly with dogs and how the dog is so kind to the people and how they are responding to the people. So just reels we can show them or in an images we can show them. So likewise we can expose the client to that particular stimulus which they are so afraid of. So first one is viewer exposure, where we can see here. So how is a person is afraid of spider? That is a classic example for systematic desensitization. So for example, first of all, which are going to see the picture of spider. Okay. So first of all, the person have to see the picture of spider in this first session or second session, depends upon the individual is going to see. And next thing is toy spider. Okay, so we can show the toy to the kid where they can see it and view. Actually, first of all, ask them to see it, and if the client is started to feeling that calmness, we can ask the client to have that with themselves. Okay, so for example, to have with them and see how the toy is going to be, which is not harmful basically, which is just the ultimate goal for us, and also make the client to believe that it's not harmful, or the ideas that they have in mind is going to come in less. Next one is dead spider. So spider is just real, but it's not alive, right? So we can show that spider. Now the client is assured that it is not going to do anything, or okay, there is a dead spider. It is not going to harm me anything, or it is not deadly or anything that they have in their mind. So it is all going to be coming down. So most of the time it is going to be different. So obviously this is a process of exposing. So the final one is live spider. So first of all, the spider is going to be kept in the either in a cage, or you can keep it in your hand as a therapist and showing it to them, like making themselves know that this spider is not going to harm me, or proving them that this is not harmful as you think it is, or what are the fears that client have, we can going to connect with them. Then if the client is feeling comfortable in that room with a alive spider, then ask them to explore expose that, for example, to show them or to keep them in their hand. It is an ultimate goal for us, the with the client, to expose, right, to be with them, and also being feeling calmness, like just positive response to that particular stimulus. Next one is imaginary exposure that I said. Imagine scenes begin with a low anxiety and gradually working towards more extreme ranges. So basically to help them to focus on their feelings, thoughts and also senses. And ask probing questions. Probing is nothing but if the person is saying something and you can ask questions from that particular scenario. It will help them to feel like, okay, someone is listening to me, someone is understanding what I am saying. So that is probing is very, very important in a session. And have the patient describe every detail. We can ask the patient to tell them what and all they are imagining, or what have you imagined before, or you are going to imagine now. So any idea what you are having. So if you ask these kind of questions to the patients, obviously it will help them to think about it. And also if they experienced anything, if they started to talk it out, it is obviously going to lower their anxiety, and gradually they started to working on that particular fear, or anxiety that is having or connected with the stimulus. Okay. Okay, there are also certain limitations for this, and it depends upon the people. It's going to different. For some people, even the thought of having a spider in a room, or a thought of the spiders existing in this world itself, it will create a particular anxiety or a fear to the people. So it is some kind of difficulty. And it's also there is a range, low, moderate, also there. So depends upon the people, it is going to change. So obviously, if it's started to delay with the process that we are using, so obviously it is going to be effective for a longer period. Obviously it is a one of the prominently used theory or therapy in exposure and also behavioral modification. So it is going to be useful, I think, for you. This is a simple form of systematic desensitization. Thank you.